Hi, Medical Skills. We're going to start covering the taking out blood pressure and what it means. Okay, for section 19.2, we will be doing the blood pressure. So blood pressure is the force of blood pushing against the walls of the blood vessels. So here are your blood vessels. I know, it's pretty sad. You can tell I'm such a nurse. I don't have balloons, but I have gloves. So I had to improvise. So my hand is my heart, and the rest of this will be blood vessels. So when the heart pumps, you see how much pressure is exerted all through the through the glove? That right there, at that point, is called your systolic pressure. It's the greatest force exerted on the walls of the arteries. When the pressure exerted when the heart is contracted, does this make sense? The heart, you hear the first beat when the contraction occurs. The diastolic pressure is the least force. So if it's systolic right here and you let go, that's diastolic. Systolic, diastolic. Systolic, diastolic. You hear the first, the diastolic is the least force exerted on the walls of the arteries by the heart. This pressure, hold on, let me put you up. Give me 1 second. There, that's better. This pressure occurs as the heart relaxes between contractions. When the heart relaxes, there's no sound. The normal systolic blood pressure is below 135, for the diastolic is below 85. The normal blood pressure range is 90 to 140 millimeters of mercury for systolic pressure. So when it's completely at its max force, it's going to be between 90 to 140. For diastolic, when it's relaxed, it will be 60 to 90 millimeters of mercury. When you record a blood pressure, it is standard. This is the way we do. Everybody writes it this way. So systolic, the max force over the relaxed force. So systolic, diastolic. Systolic over diastolic. And average is 120 over 80. When the blood pressure is above the normal range, it is called hypertension. So you've seen a lot of commercials about drugs treating hypertension or high blood pressure. What it means is the blood vessels are not completely relaxing, having less force. When the blood pressure is below the normal, it's called hypertension. You need to know these terms. All right, so the blood pressure apparatus. How do we measure this amount of force? It is measured with an instrument called a sphygmomanometer. Yeah, sphygmomanometer. Sphygmo means pulse. Mano means pressure. Meter refers to the measure. Most healthcare workers refer to the sphygmomanometer as a BP cuff or a blood pressure cuff. So yeah, we don't run around the hospital saying, "Give me the sphygmomanometer." We yell, "Get me the BP cuff." There are different kinds of blood pressure BP cuffs. There's the aneroid and electronic. This is the aneroid. This is what you will be practicing with in class. This is old school. You need to learn how to work this, because if you have a digital one and the battery goes out of it, you have to know how to use the backup manual one. This is the fancy one. It's fun, it's easy, it does all the works for you. But you still need to know the aneroid. Your stethoscope. This is your stethoscope. If you see it right here, this is your stethoscope. When you listen to a pulse sounds, you use the stethoscope. It picks up sound when it's placed against the body, so you need to place the bell against the body. The stethoscope has earpieces. Here they are. These squishy little ones are earpieces. A spring to help the earpieces keep in place. Flexible rubber tubing. This carries the sound. And a bell. This right here is your bell. And this right here. This is your bell right here. And this is your diaphragm. When you palpate the blood pressure, you may be asked to do a blood pressure by first palpating the radial pulse. This allows you to determine the correct inflation pressure. So we've already covered it, but just in case, see how the radial pulse is right, the radial artery is right there. We use 2 fingers and we palpate for it. Here's our video, and they do a better job at describing how to do auscultating a blood pressure and palpating a blood pressure. So I'm going to hush up and we're going to watch this video.
Taking a patient's blood pressure is a necessary part of our patient care. The blood pressure provides us the ability to treat and trend our patients as long as it's taken accurately. Auscultation and palpation are 2 of the most common methods used. However, there are a number of factors we should keep in mind so that our readings are accurate. The arm must be placed at heart level. Cuff size is based on limb size, so measure the cuff appropriately. Place the cuff over the brachial artery, keeping the bottom of the cuff 1 to 1.5 inches above the bend in the elbow. Insert the stethoscope in your ears with earpieces pointing slightly forward. Gently tap on the diaphragm to assure the stethoscope is positioned correctly. Palpate the brachial artery and place the bell of the stethoscope over the brachial artery. Palpate or auscultate the brachial artery while inflating the cuff to 30 millimeters of mercury above the loss of the pulse. Deflate the cuff at a rate of 2 to 3 millimeters per mercury per second. Too fast or too slow of a deflation results in missing sounds and inaccurate readings. The systolic pressure is recorded when you hear at least 2 consecutive sounds, and the diastolic pressure is recorded when the sound becomes muffled. The arm must be placed at heart level. Cuff size is based on limb size, so measure the cuff appropriately. Palpate the brachial artery and place the cuff over the brachial artery, keeping the bottom of the cuff 1 to 1.5 inches above the bend in the elbow. Palpate the brachial or radial artery while inflating the cuff to 30 millimeters of mercury above the loss of the pulse. Deflate the cuff at a rate of 2 to 3 millimeters of mercury per second. Too fast or too slow of a deflation results in inaccurate readings. The systolic pressure is recorded when you feel the return of the pulse, and it's recorded as the number over P.
Well, class, now it's time to practice what we have learned. In medicine, we have a saying, we see one, do one, and teach one. You know you've mastered it when you are able to teach somebody else. So get working on your lab skills.